Today I want to talk to you about a chronic pain condition known as CRPS, or chronic regional pain syndrome. It's a condition that affects more women than men. It can happen at any age, and 90% of cases occur after someone has a surgery. If you are someone with chronic regional pain syndrome, you may be wondering, how can physical therapy make a difference? Welcome to my channel. My name is Chadwick Oliveira, doctor of physical therapy, a clinical instructor, and a U.S. Navy veteran. I work at McGuire Physical Therapy in Fresno, California, and I have a practice that's centered around helping those with chronic pain. I have a personal history of chronic low back pain and PTSD. Chronic regional pain syndrome, also known as reflex sympathetic dystrophy, is a complex disorder known for its spontaneous or evoked onset of continuous regional pain that is disproportionate to the intensity or duration to the normal events regarding any known trauma or lesion. Features include allodynia, hyperalgesia, pseudomotor and vasomotor abnormalities, and trophic changes. What does all that mean? Well, the nervous system can either have a traumatic event happen to it, or it spontaneously occurs without any kind of traumatic onset, and the limb in question or the body part in question becomes very sensitive and can even start showing swelling or different color changes. Oftentimes, if you look these up on the internet, you'll see that the two hands look very differently, or the 2 feet look very differently, and the sensation of touch is abnormal and in extreme ways, where a light touch from a loved one or even from yourself is extremely painful. We recognize this to be a complex disorder, and it requires a team of healthcare professionals that consists of therapists and physicians to help to properly address it. Most people who are dealing with chronic regional pain syndrome are taking either a combination of medications, or have been receiving injections, or maybe even treated with surgery as well. Oftentimes they're seeing someone from mental health as well, because a condition like this does add a lot of emotional stress to your life, and mental health care can't be ignored. Physical therapy helps to complement all those modalities of treatment, because we help to restore any functional impairments. We do that by using interventions like graded motor imagery that help us to reorganize the central nervous system's premotor plan, and we progress that through to active and range of motion. We do that by progressing into active range of motion and strengthening. And our last phase is bringing in functional loading of the tissues. For pain management and hypersensitivity, we help by progressively exposing the patient to soft stimuli, non-threatening stimuli, and gradually increasing over time. And that could include temperature changes in baths, or just soft touch. Some folks have difficulty with sharp and dull, or vibration. We start small and we progress to more normal sensations. We can complement a psychological approach using principles of cognitive behavioral therapy and fundamentals like pain neuroscience education, along with helping people out with kinesiophobia. Additionally, we help to reduce muscle spasms. And because this condition can go on for many, many months, by the time someone gets to a physical therapist, they may be experiencing what's called disuse atrophy, where the muscles have now gotten small because they haven't been used. If you want more information, I got the majority of my research today for this video from CEODPT.com. They also have a YouTube channel that I recommend that you check out. If you found value in this video and you want to support my work, then like, share, and subscribe, and I will see you in the next video.